Hello everyone, this is Dr. Nasser, and in this clip I would like to discuss acute myeloid leukemia, AML. AML has several subtypes and subgroups, and there are different ways of categorizing different categories of AML. Basically, the most important one are FAB method, French, American, British system, as well as WHO method, World Health Organization, which is more accurate because it brings in the genetic components of the disease as well, and therefore is more specific. However, on a blood smear, when you're looking at this field, you observe some abnormalities in red blood cells. There are some target cells present in here, and anisocytosis perhaps to some degree exists. But the presence of these large cells, note that the cell can be basically 3 red blood cells across. Chromatin pattern is very smooth and diffused. Nucleolus present, blue cytoplasm, scanned cytoplasm. And if we look at more cells in the field, and we do see similar characteristics of these cells. This is a segmented neutrophil. This one is a very diffuse cytoplasm. It is a blast cell for sure. There are some vacuoles on this corner, but there's a nucleolus in here. These two cells are blasts, and we are unable to determine what type of blast until we have the evidence of Auer rods. And Auer rods are going to be cytoplasmic inclusions that are distinctive of myeloid lineage of these cells. This is another blast. However, I don't see an Auer rod. So the journey should continue, observing several at least of these blasts. Again, very smooth cytoplasm, 2 distinct nucleoli present, scant cytoplasm. This is a blast as well. Until we come to a cell like this. And this cell is a blast, a very large and distinct nucleolus present in here. There are some cytoplasmic vacuoles, usually indication of rapidly dividing cells in this case. You can see cytoplasmic inclusions. These are Auer rods. And Auer rods are important finding on a blood smear to be reported because depending on the patient treatment, certain chemotherapy treatments may result in a rapid destruction of these leukemic cells and causes these Auer rods to be released into the circulation, and that triggers a DIC, disseminated intravascular coagulation, and blood clotting, and it can be fatal to the patient. So the presence of Auer rods clearly indicates that these blasts are myeloid lineage and they are myeloblasts. To me, until you see clear indication of myeloid lineage, the blast should always be indicated as blast. And further analysis, such as flow cytometry studies, would be able to determine the exact nature of these immature cells. However, when the Auer rods are present, you can be certain that the lineage is myeloid family, and these are myeloblasts. This is the end of slide W2.